Is bruxism or night grinding a contraindication to dental implants? It can be, right? So I have a patient we did an all-on-4 on 6 years ago who basically just had a grinding habit even before we did the all-on-4 on him. He was 60 years old when he sought treatment with us, and he just ground his teeth down to nubs, right? And he also just recently just tore through all his multi-unit abutments, right? Obviously, grinding can be a contraindication, and that's for a full arch, like all-on-4 type of solution. What about for individual implants? Well, yes, dental implants are no different than a post that you put in the ground. And I tell people, I was like, what are they called? Like a cattle panel or cattle pole. It's a post that you put in the ground, and I have one out in my garden, and we have to like basically take physics into account. And dental implants, they don't mind vertical pressure at all, but the horizontal stresses is not what it's not what they like, right? And I'm using that example, that cattle panel that I was using in my garden, and after it had been sitting in the ground for like a season or a year, the best way to remove it is to literally give it horizontal action, eventually like pull it out. And similarly for dental implants just the physics do not like the horizontal action. Things that we could do are night guards really are nice because it can help redistribute the stress when you put that on. And if you're grinding your teeth sideways, what it can do is it can help redistribute the force so that single implant isn't getting as much force. Another solution that patients who are big time clenchers or grinders can do is that they can use something like Botox, right? And so what Botox does is it helps paralyze the muscles. They say about 80% of the population clenches or grinds their teeth. I personally am a clencher, so I also use Botox every 6 months. That's something else that we have in the arsenal that we can use. If you are a clencher or grinder, it's not necessarily a contraindication to dental implants. But if you do not use some sort of appliance to help redistribute those forces, or maybe use Botox or lighten the occlusion on that implant, meaning it's so that you're not banging so hard on that crown of that implant, then you potentially could have longer term issues with your dental implant.